Our webinar is about to begin, titled Key Elements to Successful Employee Wellness Programs with our presenter, Michelle Wong. And again, I am coming to you from JCC Association's Mandel Center for Excellence and Leadership in Management. So I want to thank you again for taking the time to join us on this webinar and give you a little bit about Michelle's background. She started her career with Club One 15 years ago after completing her master's degree in exercise physiology. In her current role as Director of Health and Wellness, Michelle drives the development of Club One wellness solutions for both fitness center members and employer groups. Michelle provides Club One partners with expert support in the development of their wellness strategy by leveraging best practices utilized across all Club One business channels, including community centers, corporate wellness, and medical fitness centers. And just before we get started, a couple of housekeeping notes. You are all automatically muted by the system. So you're going to be asked to type your questions to us. You can respond or ask questions using the question box on the side of your dashboard, and you can also raise your hand. At the end of the webinar, a brief survey will pop up. Please take the time to give us your feedback about this session and about what you would like us to focus on in future webinars. Our future webinars and other trainings are listed on our website at www.jcca.org. And all past webinars are recorded and posted to jcca.me. And now I'd like to welcome Michelle as we move into learning about employee wellness programs. Michelle?
Thank you, Steve. Thanks for that introduction. So a little bit about what we're going to focus on today. As Steve said, we're going to focus on key elements of successful employee wellness programs, and there are 6. And we are going to talk a little bit through that process about what best practices are, and I'm going to share a little bit about how Club One approaches implementing these best practices. And some of these things, you may have access to already out there through JCCA, and we'll introduce some of the others that you may not have seen yet. I'm going to use an analogy today as we're going through these key elements of building a house. So thinking about building a house, you wouldn't put your roof on first. You'd start with a plan, and then you would identify some pillars and structures that would hold up your roof. And so we're going to keep that analogy in mind today as we go through our 6 key elements. So our first element is we need to determine our pillars. Pillars become the foundation of which your program is built on. They are the critical areas of focus determined by your population's most prevalent health issues, interests, and needs. Club One programs are most commonly built on physical inactivity, unhealthy eating habits, and energy management. And for those of you who are not familiar with that term of energy management, it's not about calories in and calories out. It's actually about building capacity, helping members and employees to feel the best that they can all throughout the day. These become topics around which most of our programs are built on. So as we go through this, I'm going to talk a little bit about the what, the why, and the how of each of our pillars. So for each of our key elements, sorry. For our pillars, we create targeted programs that will resonate with greater percentages of our population. This is why we need to identify these pillars. They become our compass that we focus on and that we decide on what programs and services to offer. And by having these pillars and knowing what they are, they foster a greater value of investment, which are sometimes the soft, intangible benefits. In an employee setting, it may be improved employee morale, and also a greater return on investment, hard, tangible benefits, which may be health outcomes leading to improvement in healthcare claims experience. So how we go about this in terms of determining our pillars, we need to ask ourselves some questions. What are my population's most prevalent health issues? And we're going to talk a little bit about how we would find this information out. What are my population's needs and interests? So there may be a risk factor out there, but maybe my population isn't ready to make changes in those areas. So we need to know what they're interested in. And what's the culture? What is my employee culture? What is the culture within my center and my members? How do they respond? How do they like to participate? Do they need a lot of social? Are there groups that like to do things more on an individual and independent basis? So knowing what your culture is very important. So we talked a little bit about those questions. How do I answer these questions? So knowing my population's health risks, I can answer these through wellness screenings and risk assessments. So things like biometric information and HRAs. What are my population's needs and interests? I can do this simply through surveys. I can also do this through interviews with employees and my leaders. So I said I'd share a little bit about how Club One approaches this, and this goes back to what we do is focus our pillars on some critical few. You know, we talked about energy management being part of this. Pieces of that energy management are nutrition, physical activity, addressing risk, and then the overall energy management, how we build capacity, helping people to feel better all day long. And we do this through a solution that we call Wellness in a Box. Targeted information and programs that always, every month, consistently address these critical few areas, tying back to our pillars. And the pillars may be things like cardiovascular risk disease. The pillars may be things like high BMIs. Again, through these critical few, we can start to address the pillars. So our next key element is our blueprint. We have to have a plan. This quote here that you see is going to come up a couple of times. By failing to prepare, you are preparing to fail. In my years of experience in working with partners and companies, what I find is sometimes there's some interest, there's some excitement, there's a few dollars ready to be spent on wellness, but there isn't really a plan and there isn't really an aim or an outcome in mind. So the blueprint is the high-level design created around your pillars. The design then targets those pillars by repeatedly addressing the critical few, always going back to what are the critical few. In this part of the process, you should begin considering whether you'll provide incentives. Incentives, there's a lot of debate and big discussion about, you know, the value and the need for incentives. We're going to talk about overall program aim, and that's where incentives are going to come into play. What's your aim? Incentives require careful thought about high-level matters such as your budget, rewards, structure of it. Will they be points values? Which programs will you reward and how often? With Affordable Care Act in effect, employers can create greater stakes in their incentive programs to inspire participation or health outcomes, but it's important to consult your benefits providers with that design in mind and what can you do. Your blueprint will be your roadmap where you identify your goal and your overall aim. We're going to really dig into this. You know, what's the aim? It's so important to know what the aim is because knowing the aim will help determine your components. Your components are your strategy. It'll help determine the timing of programs, which will play into developing your calendar. It'll help with each component implementing communication strategy well in advance. And ensuring that you have continued momentum. So what I've seen is without the blueprint, there's stops and starts. You lose that continued momentum, which means you may not realize even the soft benefits, the improved morale, the improved choices in behavior change, improvements in member and employee satisfaction ratings. So having that blueprint is very key to continuing to move forward. So getting into the aim, this is where it's going to be important to know what's the end in mind. What are you ready for? What do you have the resources for, and what do you want to achieve? In my experience coming into working in this field, it was 1999 or so, .com boom, working with employers, and it was all about recruiting talent, having fun, making it that great place to work. So there wasn't a lot of measurement in place. There wasn't a lot of focus on health outcomes. So the focus was on fun and quality of life. It's moved a little bit. More employers are focusing on what we would call a conventional program. They're starting to implement some measurement. They're starting to identify risks, starting to look at, can we actually reduce some costs, not just make it a great fun place to work, but can we control that creep that everybody is seeing in healthcare costs? Can we even stay flat? And then there's also, again, looking at this as a continuum, some are moving to that aim of health and productivity. We want to know that what we're doing is really producing a result and that potentially we're going to see a dollar amount return on investment for what we spend. And typically that goal is going to be a 3-to-1, $3 return for every dollar spent. So once you know what the aim is and that focus, you can start to figure out what are the components you need to achieve that. If we look back again at the quality of life, those are fitness, wellness, nutrition, some of those things that really go into that piece that we call energy management. Those are all really key in the quality of life. As we're moving to more conventional, you're starting to implement some health screenings, maybe some nutrition counseling, some challenges. So the components start to change a little bit again. And then moving into health and productivity, you're definitely implementing a health screening. You're definitely doing a health risk assessment. You're hopefully doing some coaching with those high risks. So if you think about it, your aim may start to change, and as your aim starts to change, it's not that your components will change, it's that you'll be adding these components to your program in order to meet that goal, whatever that goal may be. This is where, I mentioned incentives, and incentives being a big piece of, do we use them, do we not, what's the value of them? If you're talking about a health and productivity model, that's where incentives can really come into play. Not that people will necessarily, there's a big debate about this, will they continue in a program because they're incentives, but dangling the carrot, we'll talk about that, may help you cast a wider net. It may help you engage employees, engage your members in programs that they otherwise wouldn't have opted into. So if you're looking at health and productivity, reducing healthcare costs as being part of your aim, then there's some things in place with Affordable Care Act that can help you do that and put those incentives in place. So I talked a little bit about these different aims as being a continuum. This diagram here will show you where's the overlap. It's not that, if my aim is quality of life and fun and, from an employee standpoint, great place to work, that I'm going to have these programs listed under quality of life, and I'm going to do fitness and group exercise. And then if I'm doing conventional, I'm going to do these other programs. It's a continuum. It's adding on. So if you're getting all the way over to health management design, you're going to still have all the programs that you would have in a quality of life program and a conventional program, but you're going to be a little bit more strategic about some of these elements. You're going to be a little more targeted. A good example I like to use is, running corporate fitness centers. We know that if you put a nice, decent fitness center in a corporate headquarters, you can get 15% of the 15 to 20% of the population to utilize that center without doing much outreach, without doing much marketing, because those who are engaged in physical activity and exercise is really a part of their daily living. They're going to come because it's convenient, because it creates a better quality of life for them. It makes it easy. But when you talk about health and productivity and reaching those who haven't yet incorporated that in and made that change, that's when you need to be a little targeted in your intervention. That's where having screenings and biometrics in place, and even looking at this from a member population, identifying risk factors and identifying people who are on the fence about change, and then targeting the right programs to those individuals is where you start to move beyond just capturing those who already get it, who already have made it a part of their life. And that's where health and productivity comes in. It's getting those engaged with targeted interventions, with incentives in the quality of life programs, and using some of these tools, having the right leadership and communication strategy in place. So, in JCCs, this would be your executive directors being involved. This would be, making sure that your leaders, your managers of each department are cross-promoting, are talking about the wellness program, are participating in the wellness program. We'll talk a little bit about that as we get to best practices when we talk about leadership advocacy. So element number 3, creating a network. So this is key, and really I think resonates with everybody when you talk about limited budgets, limited human capital and resources. Creating your network, and even more so, I think it's important to talk about this when you talk about JCCs, is making sure that all your departments and all your areas of your center are connected and working with each other and leveraging everything. So that you're connecting your members, you're connecting your employees in with multiple touch points. So we need to make sure that we're leveraging everything that we have to offer in the community through your medical plan providers. If you have an EAP in place, what resources do they provide? Do the employees know about those resources? So really helping to make sure you're maximizing on everything that's available. In my experience, I've gone in and worked with employer groups that have resources available that aren't even being tapped into because they haven't coordinated, or they don't have the person that's taken it on to integrate and really identify all those resources. So the first step in doing this and the how is really having discovery meetings, getting all your partners in the room, getting them at the table, and digging in and laying out what does everybody have available and how do we coordinate this together. And moving towards that health and productivity model, this is key. Making those things fit together. It's like pieces of a puzzle. So integrating the programs. Some of the things that will help in this integrating of your programs and things to consider, cross-promotion. Cross-promotion is key. If we look at this on a center level, it's making sure that your group exercise instructors are talking about other programs going on in your center. It's making sure that your early childhood education department, your child care, are telling parents about the great kids nutrition program, or making sure that your member services really promotes the onboarding process, and making sure that members who sign up who are kind of on the fence, it's January, they're ready to make some changes, but they're not really sure how committed they are, that they're meeting with your trainers, your coaches, that we're getting them engaged. So cross-promotion is really key. Sharing of resources, making sure that everybody knows what everybody else has to offer. And I think we talk about this a lot with JCCs, connecting your members with 2 or more touch points of the center being so key. So knowing what resources are out there is really important, and this is where the network comes into play. And ingraining it as part of your culture. We do this with some of the JCCs that we manage. We develop positions that we think of as our concierge service, that we, new members come in and we want to, introduce them to all we have to offer as part of the wellness culture. And that helps to get the results. So one of the things in terms of creating that network and pulling it all together that is starting to become a must is technology. Technology can't replace people, and the people connection is so important. And I speak to this all the time with our teams. We put out programs that are online programs, and I say don't expect it to fly and go anywhere unless you go and you circle back and you connect in with those people. But technology is important. It allows you to reach people beyond the walls of your center, beyond the office space. It allows them to stay connected and find all of these resources that we've networked together. So technology is becoming a big piece of this. It also makes it easy to reach people in multiple locations. So I work with employers that we may be servicing a center at their corporate headquarters, but they've got 15 offices across the country where we need to reach people. And a part of technology that is mobile connectivity. You know, can I get to this from my phone? Not just can I get to this from my computer, but can I get to it anywhere? So taking those things into consideration, how easy it is. And then part of this network and this technology is a feedback loop. So one of the common mistakes that I see is employers will offer an HRA, they may do biometrics, and they collect all this information, but the employee has no way to retrieve that information or to get feedback on what's the next step. So you've identified me as having high cholesterol, what's the next step? Element number 4, build it. So this is the phase where you've got the blue pillars, you've got the blueprint, you know what your aim is, and now it's time to build it. And it seems like sometimes it's a daunting task, but if you step back and lay it out and think of it as annual programs and a focus on, you know, what am I going to do for 12 months, it's not as daunting as it may seem. Our quote again, by failing to prepare, you are preparing to fail. So there has to be a plan in place, and there has to be something to keep it moving. Again, I've seen too many times stops and starts because there isn't a good plan in place and it's not built and we don't have the programs defined. So again, do this through your wellness program calendar. It's as simple as starting with 12 months, mapping out 12 months, and even if it's 2 programs to start or 2 pieces of education, in a year or 2 years, it may be 4, it may be 6. But start from your wellness program calendar. This is just an example of a high-level Club 1 wellness program calendar. Again, whether we're focusing on resolutions in January, women's health in October, or holidays, December, and maintaining our stress at holidays, we're weaving in our critical few. We're always coming back to physical activity, to nutrition, to energy management, to risk prevention. We're always addressing our critical few through these topics. And I'll talk a little bit later about, you know, the importance of that and how it's important and where the industry's going, and how things are a little uncertain with changes in healthcare. This is a more detailed calendar. So once we have our focus, again, that focus you saw in our high-level calendar, then we start to drop it into activities and events and seminars and screenings and what are we going to do through the 12 months of the year. And it may be that this calendar starts even smaller and grows. So going back to what's our aim, you know, our aim may be just fun and, you know, trying to get engagement and trying to get some member satisfaction going. And so, you know, there may be only a few things, and it may grow, and we may add screenings, and we may add layers as we move to those more conventional programs, the health and productivity program. And when considering this, thinking about community centers, this may be something where you look at all departments coming together and saying, okay, January, our focus is resolutions, or maybe it's something else, but what is every department doing to create some consistency around that focus, and how do we weave in those critical few within that focus? So deliver it. Okay, we've gone through 4 steps so far, completed, and that's kind of been the difficult part in the planning steps. The next step in delivering it is, you know, is to get going with some best practices, and I'm going to talk a little bit about those. Things that we definitely need to consider when we're delivering it is our leadership advocacy, our communication strategy, the supportive environment, incentives, and our wellness portal. So, you know, in terms of delivering it, we at Club 1, I've worked with partners who the same exact program, you put it in one place and it does okay. Maybe you get 15, 20%, you get kind of that expected, and in another setting you get 60%. And I always get the question, well, how did that happen? What's the difference? And it's these best practices. These are the tried and true. These are the things that are proven time and time again to work. So it's about, not having to reinvent the wheel and reinvent the program. If you implement things with these best practices in mind, you should have some success. So first, best practice, leadership advocacy. You need to include leaders as part of this. In your JCCs, this may be your executive directors. This can also be your middle managers in a corporate setting, department managers, but you need to have your leaders on board. And by leaders on board, what I don't mean is, well, they're going to talk about it once in January, and that's all you're going to hear, and that's all you're going to see for them. Leaders need to champion the program just as much in what they say as in what they do. So they need to be involved. If there is a fun run going on, they need to be out there. They need to be participating. If you're talking about a work environment and the leaders are not taking time throughout the day to get involved or take some time for exercise or choose, a healthy meal choice, then the employees, won't either. So it's sharing personal successes, and it's really being involved more so in not just, do as I say, but do as I do. Next best practice is your communication strategy. This, again, is where I find, some of the biggest mistakes are made in the communication strategy, that there isn't a thoughtful plan in place to promote all these programs. So if you've taken the time to identify the pillars, identify what you need to focus on, plan your critical few, put the calendar in place, don't let it fall flat because there isn't a communication strategy. Some of the things in terms of even best practices within the communication strategy are branding. I see all too often mistakes of, information being thrown out, but maybe not a consistency in the branding and the message. So members may not identify it as, is this coming from my JCC? Or employees may not go, is this really part of the benefits program, the health plan? So branding is very important. Creating an awareness, having information easily accessible. We talked about wellness portal, but also having information posted in break rooms, lobbies, areas where people are high traffic, they're traveling through. Because the more we can sort of hit them with these messages and they can see it, the more chance we have to maybe get somebody who's sitting on the fence to move them to action. And then tailored messaging. When we talk about quality of life versus health and productivity programs, this is where tailored messaging really comes into play. So the worst mistake that can be made with messaging is, this is what's in it for the company. We need to reduce our costs. We need to put more of the burden back on the employees. Or from your center perspective, what are you doing? What are you offering of value to your members? So what's in it for them? So not what's in it for you. And that's where the tailored messaging comes into play. And repetition. Just as much as we need to cross-promote and, have that information come from multiple departments, we need repetition in the message. Sometimes it takes a few times getting that message out there until somebody, again, takes action on it. And sharing success stories. This is something we talk about leadership advocacy, having those leaders share what they're doing, their success, but having your members, your employees, share their success stories. Nothing inspires change more than hearing about somebody else's success and somebody that you may know or can relate to. So you've got all these other things in place. You've got your pillars, your blueprint, your critical few, you've got your leaders speaking about it, but does your environment support it? So when thinking about it, does your facility support healthy changes, healthy behaviors? And are programs easily accessible? Can I find the information I need to find? So as much as you have to put all this in place and create the plan, you need to make sure the environment is structured so that it supports healthy choices and wellness. Having wellness champions is also part of that environment. Having people who are going to encourage others. In a corporate setting, this may be your middle managers. In your JCCs, this may be your managers and leaders in each department, or maybe a champion from each department. It may be somebody that helps to inspire others. And in addition to that, I would always think about, tying your wellness goals to personal objectives. Some employers have found success in, if there's a quarterly performance goal that's related to the business objective, what's the personal goal, and rewarding employees for meeting that personal goal. And then including family participation. So if you create a great environment in your community center, in your workspace, how can they involve their families in that? How can they take that piece home with them? Because in order to make sure that that change is sustained and those positive behaviors are reinforced, it needs to really be something that lives with them 24 hours a day. So if you can help them take that home or bring that into your center in involving families, that's also a very positive step. So incentives, we talked a little bit about incentives earlier and how they relate to the aim of your program. Whether it's quality of life and you just want to try to engage a few more, or it's health management, incentives are still a piece. Incentives may be more structured, maybe more defined, and maybe one-to-one when you're talking about health and productivity and more of a focus on health outcomes. If you want to just engage a bigger population, it may be smaller incentives. It may be, incentivizing people to, get in and use your center. I know a lot of our JCCs that we work with are using JCC rewards. So dangling a little bit of a carrot, hoping to engage people in behaviors that make them feel better, connect them with others, and ultimately then the intrinsic motivation first, right? You need to have something extrinsic sometimes first, and then hopefully we can shift that over to intrinsic motivation. And make sure your incentives are achievable for all. So the worst mistake I've seen made in wellness programs is designing a program so that the guy who's out there training and is the triathlete is always winning and always getting the greatest incentive, because the one who's just getting off the couch and doing 2,000 steps a day is never going to be able to compete or keep up with that. So level your playing field. Make sure your incentives are achievable for anybody at any stage, at any level, so that they're not a detractor. They're actually a motivator. And think about tiered incentives and rewards. So maybe there's something small for the first step, and again, depending on their level and what they're ready for, as they continue to make more progress, the incentives maybe gets a little bigger throughout your program or throughout the year. Maybe there's 5 things that your members or your employees can earn rewards for throughout the year, and when they do the first one, there's a small incentive, and for those that actually get to the 5th thing, that 5th thing, the incentive gets bigger, or it even becomes a raffle for a grand prize, and it doesn't necessarily have to always be a one-to-one. I've seen a lot of impact in terms of just, again, casting that wider net, getting more people in participation with just raffles. It doesn't always have to be somebody's going to be guaranteed to get something. Next in the best practices, this wasn't always traditionally, I think, thought of as a best practice, but it is becoming one now. Having a wellness portal, having some place that your members or your employees can get information. I think we talked about this a little bit already, having a feedback loop. So if you're offering a health screening and there's a place for them to go find that health screening result, in that same wellness portal, is there information about programs and resources for them to take the next step? So ensuring that, if they're ready and you've been able to motivate them for whatever reason, either health risks or I just want to feel better, or, my wife's encouraging me to do it, that they know and they can easily get to the programs that will address those risks. what we Club One have done is we've tried to build our wellness portal so it's all-encompassing, meaning whether our aim is, and the partner we're working with is quality of life, or whether they're looking at health outcomes and a really structured incentive design, that's all within one platform so that, again, whatever the focus is, it's easy for those individuals to find. Some of the mistakes I see is, having 4 different programs where your member, your employee has to remember a different login and a different password, and pieces of information that really should connect and speak to each other don't. So thinking about, if you're making some choices about any type of technology, how easy is it to connect it to everything you're doing? And then one of the struggles is that, there's so much out there that every day a new app pops up or a new program. It's okay, except that your members and your employees are going to use different things. And you can't offer everything, but the more you can offer within what you do offer, the more chances you'll get them using it at some point. Our goal with technology is that we know realistically we're not going to have our members or our employees in our wellness portal 365 days of the year, but if we get them in a couple times a year and that moves them to action, then we're successful, because we don't want to really keep them online. We want them moving, right? So we want them to go into the wellness portal to get the information, to get the tools, the resources they need to move and to go do something. And if that means they take their HRA with us, they kind of get a basic program going and some ideas about what their calorie balance needs to be, they need to lose weight, but then they decide that they love Runkeeper, I love Runkeeper, and I use Runkeeper, then that's okay. We did our job, we've got them moving, we focused them, we addressed the critical few, and now they're making some positive changes, and they may come back into our platform 6 months, a year later to reassess and get a new picture of their health based on updating their HRA. Last element is evaluate it. So you've done all this work, you've built your program, you've delivered it. So important step not to miss is the evaluation piece of it. And I still think that we are missing that a lot of times out there, that we're forgetting to evaluate it. One of the things with small budgets and wellness sometimes always being the top layer of what's on the chopping block, having your evaluation and proving the value of your programs, whether they be the soft benefits we talked about or the hard, ROI, having that evaluation is really key to justifying it. So it also provides insight to what's working and what's not. So when we talk about casting a wide net and improving participation, that's great, but if the fall-off rate is really high, then, there may be something we need to address about it. So unless we do the evaluation, we won't know. So how do we evaluate the programs? There's some things we can do to evaluate the program. Understand what are our meaningful metrics. And these may be different based on what our aim is, whether we're just trying to engage people in positive health behaviors or whether we're really trying to impact health outcomes. So participation rates are always a great place to start. One of the easiest things to do is how many people do we have participating? If we've implemented a wellness program, has our participation year over year gone up? Is our usage in our fitness center going up? And can we tie that back to the implementation of a new onboarding process or a new lifestyle coaching program? Satisfaction rates. Are your members happy with the program, or are employees happy? Are they willing to recommend these programs to others? And then completion rates. We talked about that a little bit. Not everybody's going to complete every program, and that's okay. Sometimes it takes a couple of tries to get somebody to complete a program. They may come into your 10,000 steps program 1 year and only get 4 weeks into the program. That's 6 weeks, and maybe the next year they come in and they get 6 weeks completed. So completion rates are important. Behavior change, and sometimes it seems hard. Like, how do I know? How do I measure behavior change? It can be simple as doing a survey pre and post in your program. understanding, how many days a week is somebody exercising at the beginning of this program, and for how many minutes, and how many days a week, and for how many minutes are they exercising at the end of this program. And if that number goes up significantly, then you've created a behavior change. Health outcomes would be something that you'd be looking at more in that health and productivity, results-oriented cost savings program where you're doing HRAs and biometrics every year, and you want to know, did the cholesterol level drop? Are we having less people who are identified as pre-diabetic? Is the average BMI going down? And then risk stratification is another thing that can be looked at. And again, if you've got that wellness portal in place, this is where this may be easy to identify as how many people do I have in a high-risk category, and if I implement these programs the next year, how many have I moved to a moderate or a low-risk category? That shows a great value for implementing that program. So the measurement tools associated with all of these things are your online and mobile wellness portal. In many cases, all of these metrics can be captured if you've got a very robust wellness portal. Customer service platform, in your community centers, this may be your member management system. So this may be a retention management piece, understanding, how many times people are visiting, understanding the satisfaction. So a lot of that you can potentially get from those types of platforms. Some tracking is just, good old Excel spreadsheets. I may be tracking information and usage and attendance through that information. Am I seeing peaks in program attendance for certain programs once I've implemented a new communication strategy? And then online survey tools. I use SurveyMonkey continuously within our programs as just a real easy tool to, again, collect behavior change information, satisfaction information, doing some pre and post if I'm about to launch a 6-week program. Understanding what are some of the behaviors at the beginning and how am I able to change those behaviors after the 6 weeks. So the way we've implemented and addressed these best practices is Club One, just kind of sharing some of our strategies, is we do have a wellness portal that, again, looking at our partners, some of them are still in that, quality of life, feel good, fitness and nutrition, let's just do that. And some need an HRA and want to look at health outcomes. And so we've implemented a portal that has a variety of tools. Taking it to the monthly calendar, we've created, and I know many of you on the call get this information, our health education that comes every month as part of what we call our Wellness in a Box, making it easy for our partners to plan that year and have at least some resources to plug into every month as they're looking at that network and who can also support and provide additional resources. And then providing expert support, making sure there's a good communication plan in place, making sure that the marketing is there. When we talk about branding and repetition and consistency and tailored messaging, that's all part of the marketing plan. And again, the annual program calendar. Sometimes it's just about sitting down in 12 months and what are we going to focus on in those 12 months, and what resources do we have within each department in our center, what resources do we have from our benefits providers, from our EAP, and plugging all those into a spreadsheet. All right, that's it. Those are our 6 key elements with some best practices, and I'm happy to take questions.
Currently don't have any, Michelle, but one of the things I meant to say was that if anyone has any questions that they would like after the webinar is over, please send them to me and I will make sure Michelle gets them, and I will get them out to everyone that participated in the webinar. And I want to thank Michelle again. She and Club One have been wonderful partners for JCC Association in a lot of different facets, including our Discover initiative helping JCCs transition from fitness to wellness. And you're going to be hearing a lot more about that in the coming months. And is there anything else you'd like to add, Michelle, before we sign off?
I think that's it, Steve, but I'm happy to take questions offline, like you said. So if they want to send them to you or directly to me, I'm happy to respond.
Just please, everyone on the call, don't forget to complete the short survey. It'll pop up when you exit the webinar, and we hope you join us again on future webinars. And if you have any questions about professional development or suggestions for upcoming topics, please contact Joy Brand at joy@jcca.org. I want to thank Michelle again and Club One and all of our colleagues out there. Thank you very much.
Thanks, Steve.
Bye all.